Good evening. So welcome to Thursday Reading Live. My name is Vandana PS, one of the reading trainers from Needus Academy. As usual, I'll give you a sample question from part B. So if you guys are doing this question, definitely you can, or നിങ്ങൾക്ക് എന്തായാലും എന്തൊക്കെയാണ്, what are the type of question, what is the category, everything you will get to know. Okay, so please do this question. I'll give you 2 minutes, then I'll discuss the answer. So here comes the question. Yes, welcome back. Good evening once again. Amy, Shijana, yes, Biyu, Sony, good evening. Monita, good evening. Okay, so have you all done this question? I'll read the question. From the previous material, from the previous question, already you guys know what is the meaning of the word downside. Okay, so what downside is stated regarding swing bets? So downside, which means, what is the meaning of the word downside? Any idea? Hi Clarina, good evening. So downside, which means drawback, disadvantage. Okay, so what downside is stated regarding swing bets? So my keywords, downside and swing bets. So these are my keywords from the question. Alright, and what category of question is this? It in the category of question or this particular question comes under this category. Which category? Either category lo varuna question aanu. Yes. So we have 3 categories of questions in part B, and this particular question comes under the second category. Okay, so this comes under the second category, manual. Alright, so what is a manual? So manual, which means it's kind of a booklet, a small booklet, and it will gives you some ideas or some main ideas, speciality, functionality, or some information about a particular machine or equipment, device or medicine. So here this is all about swing bets. So that means this is a manual. And the question is asking you, what is the drawback of this swing bets? Idinte disadvantage endana? Adana question. So question is very clear, very specific. And when you read the question, always connect with your option, right? Okay, so yes, Vishu, yes, it is manual. Yeah. Yes, Amy, this is a manual. And I'll read the options. Staff with less experience can look after the patient. So my keywords, staff, then less experience. So these are my keywords from first option. And second option, special arrangements should be facilitated to accommodate the bets. And my keywords, special arrangements and facilitated. From option C, use of bed should always be in a pool of 8, which is dangerous. So my keywords, use, then always, 8. So these are my keywords from these 3 options. Okay, അപ്പോൾ എനിക്ക് ഞാൻ വിചാരിക്കുന്നു നിങ്ങളെല്ലാവരും കീവേഡ്സ് മാർക്ക് ചെയ്തിട്ടുണ്ടാവും. I think so. I'll read the paragraph. Inpatient units are generally classified according to the clinical specialties treated. In a home unit, staffs have the expert knowledge of the associated diseases and treatment modalities. When no beds are available in the home unit, patients have to be accommodated in another unit where staff may not have the necessary clinical expertise, and oversight by medical staff may be less than optimal. For this reason, the concept of swing beds was devised so that such patients could be accommodated as close as possible to the home unit. Swing beds may comprise a single bed or a group of beds which may be quickly converted from the one category of use to another, from one clinical specialty to another. And from the first para last line, very clearly mentioned, swing beds may include, comprise, which means may include what? A single bed or a group of beds. So it is not necessary it should be a pool of 8 beds. Pool of 8 beds venam nirbandhilla. It's not necessary. But in option C they have mentioned use of beds should always be. So where is this always be? Should always be mentioned. Nirbandho aanu, it is necessary. Not necessary. So opposite option or contradictory option. Maybe it will be single bed or a group of beds. However, there may be workload allocation and physical design issues which may result in the use of swing beds being unsafe and excessively demanding on the staff in the unit required in the management to manage the patient. Facility designed for swing bed require additional corridors and what? Provision. So it needs design for swing bed require additional corridors and provision for switching, supervision and nurse call systems from one staff station to another. So what is this? It's not a speciality, it is the question, what is the downside? What is the drawback of swing bed here? Even though a lot of advantages mentioned, the disadvantage is that it requires additional corridors. Okay, and provision for switching supervision and nurse call system from one staff station to another for this arrangements. The technology to support swing beds require user-friendly functionality. An 8-bed port configuration may facilitate the use of swing beds. Again, it is may facilitate, not should always be. Okay, so from these particular lines, you can trace towards which option? Option B. Special arrangement should be facilitated to accommodate the beds. Okay, very clearly mentioned in this particular line. What about option A? Staff with less experience can look after the patient. Here, question is asking you about what? The disadvantage or the drawback, downside of swing bed. Okay, but in option A, there is no connection with staff and swing beds here. Okay, if it is a manual, it talks about a device, machine, instrument, medicine or equipment, whatever, yeah. There is no connection with staff or animals or human beings here. It's all about the speciality of that particular device or a machine or instrument or a medicine. So that you can eliminate option A again. We can say opposite option or contradictory to the question. Answer is option B. Special arrangement should be facilitated to accommodate the beds. That is the correct answer. Clear? Okay. So let me check your comments. Yes, Monita. It is B. Yeah, correct answer. Yes, that's true. It is option B. Anjali, Akshay. Very good, Anjali. Yes, happy? So answer is option B. Special arrangement should be facilitated to accommodate the beds. That is the correct answer. Alright. So now we are moving to the self-prepared material. Okay, BU Sony. Yes, very good dear. It's option B. Very good. So now we are moving to the self-prepared material. Yeah. So for part A, which is plantar fasciitis. Okay, plantar fasciitis. And how is the material? I promised you on the previous day. So today's material as well as tomorrow's material will be difficult for you. So how was the material? I mean, not that much difficult anyway. Yeah, it was. Right? How was the material? Material cheydo. Print out editho. So please don't look into the phone and do the material because it gives you a lot of strain for your eyes. So please do take the printout of the material, then do the material. Be better. Okay, so that you can underline certain words from the text and you can, read, understand a lot of things by touching the material. So everything is connected, right? So yeah, how was the material? Okay, Aksa, phrases meaning engana C partil edukkunne. Actually, there is no, to be frank, there is no easy method for getting the meaning of the word or the phrases in part C. Part C, il namukku oru word inde meaning chodikkumbom ഇതാണ് അതിൻ്റെ മീനിങ് എന്ന് പറഞ്ഞെടുക്കാൻ it will be very difficult. Okay, but the question type in part C have actually 2 different types of meaning questions. നമുക്ക് already you guys know, out of 8 questions, എങ്ങനെയാണ് 6 questions will be the content related questions and 2 questions will be lexical or meaning questions. 2 എണ്ണം lexical or meaning question ആയിരിക്കും. And in this lexical or meaning question, I can say, sometimes they will ask you what is the meaning of the word or what is the meaning of the phrase. ഇതിൻ്റെ meaning എന്താണെന്നുള്ളത് directly they will ask you. And sometimes what they will ask you, why that phrase is mentioned there or what is the purpose of the word there in the paragraph. Or they will ask, writer has mentioned a phrase in the paragraph to show that. എന്തോ ഒരു കാര്യം കാണിക്കാനാണ് writer ആ meaning അവിടെ കൊടുത്തിരിക്കുന്നത്. And what is it? So in that occasion, they are not asking you what is the meaning of the phrase. അതിൻ്റെ meaning അല്ല അവർക്ക് വേണ്ടത്. What is the concept idea there? Okay, so the only thing you can do is, if you don't know the meaning, okay, you can replace with your options. Or option ആയിട്ട് replace ചെയ്ത് നോക്കുക. Okay, so that is the only way if you don't know the meaning of a phrase or a word. And another thing you can do is that, do read. Okay, if you're reading every day, you will get a lot of, synonyms, idioms, phrase from different books and different, maybe from newspapers or whatever you're reading, you'll get a lot of phrases. So that you can get a lot of meanings. Okay, so ഞാൻ എൻ്റെ സ്റ്റുഡൻസിനോട് യൂഷ്വലി പറയുന്നത് എന്താണെന്ന് വെച്ചാൽ യു ക്യാൻ ടേക്ക് എ നോട്ട് ബുക്ക് ആൻഡ് യു ക്യാൻ റൈറ്റ് ഡൗൺ അറ്റ്ലീസ്റ്റ് 5 ഡിഫറെൻറ്റ് വേർഡ്സ് ഫ്രം വാട്ട് എവർ യു ആർ റീഡിങ്. നിങ്ങൾ എന്താണോ വായിക്കുന്നത് അതിൽ നിന്ന് നിങ്ങൾക്ക് അറ്റ്ലീസ്റ്റ് ഒരു 5 വേർഡ്സ് നിങ്ങൾ ഡിഫറെൻ്റ് ആയിട്ടുള്ള വേർഡ്സ് നോട്ട് ഡൗൺ ചെയ്യുക ഓരോ ദിവസവും. ആൻഡ് അറ്റ് ദി എൻഡ് ഓഫ് ദ ഡേ അല്ലെങ്കിൽ അറ്റ് ദി എൻഡ് ഓഫ് ദ വീക്ക് ഓർ അറ്റ് ദി എൻഡ് ഓഫ് ദ മന്ത് ആകുമ്പോഴേക്കും യു വിൽ ഗെറ്റ് എ കളക്ഷൻ ഓഫ് വേർഡ്സ്. അല്ലേ, നിങ്ങളുടെ കയ്യിൽ ഒത്തിരി വേർഡ്സ് ഉണ്ടാവും. സോ ഡെഫിനറ്റ്ലി വെൻ യു go through this type of words, you will remember. നിങ്ങളത് വായിക്കുമ്പോൾ അല്ലെങ്കിൽ when you do the exam material, you will remember a lot of meanings. നിങ്ങൾക്ക് പെട്ടെന്ന് അത് കണക്ട് ചെയ്യാൻ പറ്റും. Okay, so these are the easy methods to understand certain phrases or idioms or some words. Okay, yes, so coming back to this material, yes, okay, plantar fasciitis. So how was the material? എങ്ങനെ ഉണ്ടായിരുന്നു? How was the material? Easy ആയിരുന്നോ? No comments about the material. I think it was very easy for you guys. I don't know. Anyway, so I will read and underline what are the keywords from the material, then we will discuss the question answers. Okay, yes. So plantar fasciitis, difficult. Yes, hi Varsha, good evening, how are you? Hi Anjali, difficult. Yes, Varsha, tough ആയിരുന്നു. Amy, average material. Okay, Amy. Okay, so coming to this one, plantar fasciitis, I'm underlining the meaning, the noun. Inflammation in the plantar fascia in your foot. It is the most common cause of heel pain. The plantar fascia is strong, then fibrous attachment similar to ligament that runs from your heel to the ball of your foot and your toes. It is stretchy like a thick rubber band. The plantar fascia connects the bones in your foot together and forms the arc of the bottom of your foot. Plantar fasciitis happens when your plantar fascia is overused or stretched too far. Anything that damages your plantar fascia can make it swell. This inflammation makes it painful to walk or use your foot. Most people, I'm underlining certain words, please do listen carefully and think about why I'm underlining certain kind of keywords from the text. Okay, ഞാൻ വളരെ സ്ലോയിലാണ് വായിക്കുന്നത് because you have to know what are the keywords which I'm underlining and what is the reason behind it. We'll be discussing. Okay, so most people experience plantar fasciitis in one foot at a time, but it is possible for it to affect both your feet at once. So as you can see here from the first paragraph, a lot of keywords which I have underlined, which includes nouns, okay, the words which indicate time, the words which indicate experiment as well as research, and brackets I have underlined. Then what about the next one? Plantar fasciitis is extremely common. Okay, and see guys, when you comment, when you are commenting, you can see a lot of fake messages. Maybe you will get a lot of fake messages from a lot of fake people from fake institutions. So please don't fall for them. അവിടെ നമ്മൾ വിശ്വസിച്ച് തിരിച്ച് മെസ്സേജ് ചെയ്യാനോ കോൺടാക്ട് ചെയ്യാനോ ഒന്നും പോകരുത്. Okay, so please do report and block them. That is a simple thing you can do. All right, so I can see a lot of fake messages for your replies when I just look into your comments. So please do block them, just report them. Okay, yes, so plantar fasciitis is extremely common. More than 2 million people in the US are treated for it each year. Around 1 in 10 people will develop plantar fasciitis at some point throughout their life. Anything that irritates or damages your plantar fascia can cause plantar fasciitis, including, so what are the points? Being on your feet all day for work, playing sports, exercising or working or on a hard surface like a warehouse floor or a sidewalk, exercising without stretching or warming up, then wearing shoes that don't support your feet well enough, then like flip-flops and flat flexible sneakers, then walking or standing barefoot while you're at home. Okay, so not a lot of, but still some bullet points mentioned. Then what about this one? Some health conditions can cause plantar fasciitis, including high arch feet, then flat feet, obesity or gaining more than 15 pounds in a few months. So these are my keywords from text A. And when you look into this particular text A, you can see a lot of keywords which I have underlined on the basis of the strategy which already I have told you. ഞാൻ നിങ്ങളോട് ഓൾറെഡി പറഞ്ഞിരിക്കുന്ന ഒരു strategy follow ചെയ്തിട്ടാണ്, which I've underlined the keywords from here. Okay, so now we are moving to the next one, text B. What is it? Evaluation. Okay, maybe medical evaluation. Yes, evaluation is mentioned here. Plantar fasciitis is diagnosed through a physical exam and patient history. So what does physical exam mention? A doctor will check your tenderness in your foot and may press on your heel and other areas at the bottom of your foot. They may also ask to flex your foot and walk to see if you are altering your gait. Then patient history. Your doctor will ask about your symptoms, including where on your foot it hurts and when it's the most painful. They will also consider your risk factors such as your age, activity level and anatomy. Imaging test, then rest of it's all about what are the medical examinations or imaging tests which you can follow because of this. To confirm the diagnosis or rule out which means to find out other causes of foot pain. So what is that? X-rays, ultrasound. Okay. And in this particular bullet points, ultrasound is a little bit lengthier, so I'll read it. Can show thickening and swelling of plantar fascia and can confirm a diagnosis. Ultrasound should be considered the first choice modality for assessing plantar fascia or PF disorders due to its affordability, speed, dynamic imaging capabilities, high resolution depiction of the PF, and ability to compare with the collateral side. Conventional radiographs can reveal several indirect indicators of PF disorders and should be examined even when patients are being assessed for other reasons. MRI, while reliable in delineating both soft tissue and bone anatomy of the sole of the foot and enabling accurate diagnosis of PF disorders, is expensive and should be considered a second-line imaging option. Then MRI is there, Windlass test is there, ultrasonography is there. Anything else? Yeah, so that's all about the imaging test mentioned here. And as you can see here in this particular ultrasonography, there are some numbers mentioned related to this imaging test. So what are the numbers mentioned here? Have a plantar fascia 2.16 mm thicker when compared to your control group and typically had plantar fascia thickness of 4 millimeter or whatever mm and above. So these are my keywords from text B. And text C, as you guys know, one of the texts will be a pictorial of something. Okay, a pictorial item, maybe a diagram will be there, or a flowchart will be there, or a graph will be there, or a table will be there. So yeah, for sure. And what about text C? It is a study. Okay, number of patients included, identification, screening, eligibility, and the number of patients included, articles mentioned, numbers, a lot of numbers mentioned here, articles evaluation, okay, strategies, PF, then diagnosis, 573, yes, okay. So these are my keywords from text C. And what about text D? A lot of bullet points, right? The most common treatments for plantar fasciitis include, so common treatments include, what are they? Over-the-counter NSAIDs, then like aspirin, ibuprofen, naproxen, reduce the pain and inflammation, and don't take NSAIDs for more than 10 days in a row without talking to your healthcare provider. And you can take rest. Okay, then what is next? Icing your foot, okay, 10 to 15 minutes twice a day. Cover a frozen water bottle with a thin towel to protect your skin, then roll it along with the bottom of your foot to massage the inflammation. Then wearing supportive shoes, okay, additional fittings, what is it? Supportive shoes, wear sturdy, well-cushioned shoes. Don't wear sandals, flip-flops and other flat shoes without built-in arch support. Don't walk with barefoot. Then orthotics or shoe inserts. Then what is next? You can add inserts into your shoes and add extra arch support. Again, additional fittings mentioned. Your provider will suggest either pre-made inserts you can buy over the counter or custom-made orthotics that are modeled to the exact shape of your foot. Immobilization is mentioned here. Wearing a walking boot, sometimes called a walking cast or pneumatic cam walker, for a few weeks will hold your foot in place and take pressure off your plantar fascia. Your provider will tell you how long you will need to wear a boot. Then massaging and stretching. Your provider or your physical therapist. Okay, something has happened. Yeah. Maybe some network issues, I think. Yeah, so whatever, already I've underlined a lot of keywords, everything gone. It's okay. Anyway, so immobilization is there, and massaging. So corticosteroids are anti-inflammatory medicines. Your provider might inject a corticosteroid like prednisone into your plantar fascia. Then platelet-rich plasma, which is PRP, as well as electrocorporeal pulse activation technology, or EPAT. Okay, so these are my keywords from TextD. And when you guys are reading, don't skip a line. Okay, don't skip a line. Read each and every line, which is very important. Even though it is a small box or something, please don't skip anything. Read it completely, but do practice skimming and scanning. Okay, so now I am coming to the question session. Okay, so plantar fasciitis questions. For each question 1 to 7, decide which text, whether it is A, B, C or D. The information comes from, you may use any letter more than once. Okay, so that's it. That is the important instruction here. So question number 1. Okay, so please do comment your answers. Hi Asha, good evening. First one, how corticosteroid is dispensed into the body? Okay, so my keywords, corticosteroid, dispensed, body. Yeah. Any idea? What is the correct answer for question number 1? How corticosteroid is dispensed into the body? So these are my keywords, corticosteroid, dispensed, body. Yes, Anjali, Varsha, Asha, Amy. Any idea what is the correct answer there? Any idea? Yes. Any other answers? Okay. So answer is in text D. Very good. Yes, Amy, Asha, Varsha. Yes, answer is in text D. So keywords, corticosteroid, dispensed, body. So where? In which text? Text D. Where is it mentioned? എവിടെയാണ് ഇത് മെൻഷൻ ചെയ്തേക്കുന്നത്? As you can see here, okay, in text D, very clearly mentioned in the third last point, corticosteroids are anti-inflammatory medicines. Your provider might inject a corticosteroid like prednisone into your plantar fascia. Okay, so a very direct answer, which is text D. Okay, so got 1 marks. Kitile. Okay. Yes, Amy, Asha, Sanla, Dilu, Alina, Vineet. Yes, Sarin. Hi, Sarin. Yes, it is in text D. Second question. What we are asked to do by the doctor during the health checkup? So my keywords, doctor, then during checkup. Any idea about the second question? What is the correct answer? Whether it is text A, B, C or D. What are asked to do by the doctor during the health check? So yes. Any correct answers? Why B? Your answer is correct. Very good. Answer is in text B. So yes. Why it is text B? Okay. Yes, Varsha, Asha. A lot of correct answers. Yes, Amy, Monita. Okay, why Monita it is in text D? Yes, Dilu, text B. Then Lakshmi, Stanila, B. Okay. Answer is in text B. I agree. So, why? Where is it mentioned in text B? What we are asked to do by the doctor during the health checkup. So, because of 2 reasons, you can select text B. Because of medical evaluation mentioned here. Okay. As well as what is mentioned? Physical exam. A doctor will check your tenderness in the foot. That particular bullet point. As well as in the second one also, patient history. Okay. So the doctor will do a checkup. So that is evaluation, medical checkup, medical examination. So answer is mentioned in text B. Very good. Yes. Alright. Third one. Predictable contraindications assessed during the medical examination. Little bit tricky, but I think you guys already got the correct answer, right? Okay, so predictable contraindications and examination. Yeah. So predictable, which means predictable contraindications, I can say predictable. What is the meaning of the word predictable in this context, in this question? Yeah. Very good. Answer is correct. What is the meaning here? Here we can say common. Okay. Contraindicators, I can say what? Risk factors or complications. Yeah, the more specific word is risk factors assessed during the medical examination. So yeah, now it is very simple, right? Common risk factors assessed during the medical examination. So answer is text B. Again, text B. Very good. Okay, Dhanalakshmi, Alina, Dilu, Amy, Varsha. Very good, very good. Answer is correct. Okay. And where is it mentioned? Third question. Risk factors. So examination is here, and see, they will also consider your risk factors such as your age, activity level and anatomy. Alright, so answer is B. Then question number 4. What all aspects lead to the onset of plantar fasciitis? So my keywords: aspects, onset. Yeah, already that is this heading and the title, the topic. So I'm not marking plantar fasciitis. So keywords from the question: aspects and onset. Yeah, so what about the fourth one? What all aspects lead to the onset of plantar fasciitis? Any answers? Any correct answers? Yes. Okay. Yes, Alina, Varsha. Very good, very good. So answer is from text A. Okay, answer is mentioned in text A. Yes, Amy, Dilu, very good. Answer is mentioned in text A. And where is it mentioned? What all aspects lead to the onset of plantar fasciitis? So what are the factors it can lead to this condition? So where is it mentioned? Okay, so some health conditions can cause plantar fasciitis, including, especially in the last line, as well as in this particular paragraph also. Okay, so what are the factors including that? Alright, it is in text A. Very good. Yes, Dhanalakshmi. Sankita. Yes, Sankita. Very good. Okay, Vineet. It is from text A. Fifth one. Rationales to evict certain articles. Okay, so my keywords: rationales. So rationales in this context, which I can say reasons. Okay, evict, which means exclude. Okay, according to this text, it is exclude certain articles. Yeah, a very direct one. Rationales, which means reasons, and evict, which means exclude. Okay, and the answer is mentioned in yes, Saran. Yes, Saran, Monita, Vineet. Yes, it's from text A. So what about question number 5? Reasons. So where is reason mentioned? Rationales to evict certain articles. So rationales, evict articles. Fifth one. So I think fifth one is mentioned in text C, right? No. Yeah, it's mentioned in text C because, as I already mentioned, it's all about a study. Okay, and then in the study, as you can see here, this is a flowchart mentioned. Okay, so exclusion criteria, or the patients who are excluded, which is directly mentioned here. So that answer is option, text C. Yes, Amy, Dilu, Saran. Yeah, text C. Seventh one, the predominant obligations of plantar fascia in the human body. So predominant obligations and the human body. So predominant obligations. Yes. What about question number 6? Yes, Monita, correct answer. Fifth one is option C. What about sixth one? Anyone with the correct option? Sixth question. Okay. So the predominant obligations of plantar fasciitis in the human body. So predominant obligations, human body. Well, my answer is yes, it's from text A. Okay, obligations of plantar fascia in the human body. So what are the obligations? Yeah, where is it mentioned, Dilu? Your answer is correct. Very good, Dilu, which is mentioned in text A. But where this predominant important obligations of plantar fascia in the human body mentioned. Okay, so as it means here in text A, a lot of irritations or damages mentioned here. Anything that irritates or damages your plantar fascia can cause plantar fascia, including. So a lot of what? These type of damages or irritations mentioned. So answer is from text A. Clear? Important problems. Yes, obligations. And what about question number 7? Further fittings that may aid someone to make the grade with difficulties during recovery. My keywords: further, then fittings, as well as difficulties, or you can underline fittings, difficulties, recovery. Alright, yes. So what about question number 7? Yes, sixth one to say Dhanalakshmi, Monita, Amy, Dilu. Yes, very good, very good. So next one, 7th one. What about question number 7? Further fittings, additional fittings, further fitting, which means additional fittings. So already when I read text D, so did you guys remember? Okay, ortho ningal. See, in text D, as you can see, a lot of things mentioned regarding icing on your foot. Ice your foot for 10 to 15 minutes twice a day. Cover a frozen water bottle with a thin towel to protect your skin. As well as here, wearing supportive shoes. Okay, and orthotics or shoe inserts. You can add inserts into your shoes. So likewise, in these three, especially in these 3 bullet points, very clearly mentioned what are the extra fittings, or not extra fittings, additional fittings or further fittings. So answer is mentioned in text D. Very good, Dilu. Answer is correct, which is D. Alright. So anyone with 7? Anyone with 7 out of 7? No? Okay. So now 8 to 14, short answer questions. Yes, you can write in a word or a short phrase. Maximum 2 to 3. First one. Oh, very good, Varsha. Excellent. Okay, 7 out of 7. Very good. So first one. Okay, Dilu, very good. Excellent, dear. 7 out of 7. All right. Anyone else with 7? No. Okay. So the first one, 8th one. Multitude of features systemically got gauged positive prognosis. And this is one of the toughest question, I think, from this part A. Okay, multitude of features systemically got gauged positive prognosis. So different and a lot of words which is unfamiliar to you, right? words so multitude of features, which means features. So what is the word feature in connection to the text mentioned here? So features, which means articles here. Okay, but ചെറിയൊരു idea കിട്ടി articles എന്ന് പറയുമ്പം it is in text C ആണോ? Yes. Multitude, which means number. Multitude here means the total number. Okay, so number of or total number. I'm just marking number of. Of is already here. So number of articles systemically got gauged. Gauged എന്ന് പറഞ്ഞാൽ എന്താ? Evaluated. Okay, gauging, evaluation, measuring. So here it is evaluated. To prognosis. And this is very clear for you because ninga അറിയാൻ പറ്റും. So what is prognosis, which means diagnosis in this context. Okay, this is the question. So read the question. What is the question? Number of articles systemically got evaluated positive prior to diagnosis. Okay, so this is the question. So now tell me your answer. And already ഞാൻ പറഞ്ഞു, this is from text C. So please do tell me what is your answer. Number of articles systemically got evaluated positive prognosis. Yes. Where is it mentioned? Text C lana. What is the correct answer? Any idea? Anyone got the correct answer? I'll show you the answer. Answer is mentioned here. Kanda. Articles for evaluation. Very direct answer. This is 143. So answer is 143. Okay. Number of. Answer is 143. No, it's not 573. It is 143. Okay, 143 ആണ് കേട്ടോ. Because articles for evaluation ആണ്, that is here 143. Okay, so that is the correct answer. And also mention diagnosis. Okay, if it is strategies for PF, answer is 430. Alright, so diagnosis already mentioned there, prognosis. So answer is 143. Yes. Next question. But before that, see, in 7th question, there is a word. It is actually not a word, it's a phrase. The phrase is make the grade. So what is the meaning of the word? Make the grade. Any idea? What is the meaning of this phrase? Make the grade. എന്താണ് ഇതിൻ്റെ meaning? So meaning is cope up with, associated with. Okay, that is the meaning of the phrase make the grade. And question number 9, prospect of patients who are undergoing treatment of plantar fasciitis every year. And my keywords prospect, then undergoing, every year. Yeah. So what is prospect here? Prospect of patients. What do you mean by prospect of patients? Here, prospect of patient, which means the probability of patients. Probability. Okay, of patients who are undergoing treatment for plantar fasciitis every year. Yeah, then the question is very simple. Probability of patients. Again, a number, maybe a group. Yes. So what is it? Probability of patients who are undergoing treatment of plantar fasciitis every year. Answer is in text A. Okay, as you can see here, what is the probability? More than 2 million people in the US are treated for it each year, every year. So answer is more than 2 million. Alright, more than 2 million is the answer. Then question number 10. In EPAT, what shall be administered to the patients to augment blood flow? So my keywords, administered, EPAT, augment. Yeah, so these are my keywords. And where is it mentioned? EPAT, administered, augment. Dilu dear, it's not 2 million, it's more than 2 million, okay? More than 2 million. That is the answer. What about 10th one? In EPAT, what shall be administered to the patients to augment, which means to increase, okay, the blood flow. So what is it? So we have two chances there. Either you can write what? From text D. Yes, what you can write there? Yeah, concentrated acoustic waves you can write. Or you can write sound waves. Okay, either you can write concentrated acoustic waves or you can write sound waves. Either one. They will strike it off. Okay, because 1, 2, 3, 4, 5 words. So either you can write concentrated acoustic waves or you can write sound waves. Clear? Yes, Amy, Alina, Sanila, Dhanalakshmi. Yes, very good. Correct answer. And the very next question 11, which cause of the foot pain can be appraised through X-ray? Yes, Dilu, it is sound waves. Yes, Alina, correct answer. Yeah. Okay. So which cause of the foot pain? So my keywords, foot pain, appraised, X-ray. So X-ray is mentioned in text where? Text D or text B? Text B, right? Yes, text B. Okay. So what about the answer? Answer is here. Can rule out other causes of foot pain such as a stress fracture. Okay, and not stress fractures. Answer is stress fracture. Okay, stress fracture is the answer because what? Which cause naana chodikkunne? Not causes. Cause aanu. So answer is stress fracture. And the important thing is that you have to write it as a stress fracture. Okay, because in the text very clearly mention what? The article. Kando. A stress fracture. Otherwise your answer is wrong. Okay, So answer is A, stress fracture. That is the correct answer. And what about 12th one? How much weight might be gained by an individual in certain months to become a risky candidate for plantar fasciitis? So keywords, how much, weight, and risky. Yes, very good, Saren. Stress fracture. Yes, stress fracture. Okay, and 12th one, how much? So when they ask how many or how much, answer will be what? A number. So what is the correct answer? How much weight might be? What is the correct answer there? How much? Where is it mentioned? How much weight? How much weight is mentioned? Here, yes. High arch feet, flat feet, obesity, or gaining more than 15 pounds in a few months. See? Okay, so 12th question, right? Yeah, how much weight might be gained by an individual in certain months? That means certain months, a few months. And answer is, you can write 15 pounds. Okay, 15 pounds is the answer, because you don't have to write more than 15 pounds there, because question is how much, etra. There needs a number. Okay, 15 pounds. That is the correct answer from text A. Then 13. One of the corticosteroids advocated to patients in the form of inoculation. So my keywords, corticosteroids, advocated, inoculation. Inoculation, which means injection, vaccination. Okay, injection. And what about that one? 13. One of the corticosteroids advocated to patients. Yes. Yeah, very direct answer in the bracket, right? It is again in text D. Yeah, corticosteroid like prednisone. Okay, very good, Alina. Your answer is correct. Yes, Delu, it is 15 pounds, the previous one. So answer is prednisone, which is mentioned in text D. Then 14. Which evaluation proofs would be the best to reveal indirect indicators of PF disorders? Evaluation proof indicators, yeah. So what about question number 14? Which evaluation proof would be the best to reveal the indirect indicators of PF disorders? What about that one? Is it ultrasonography? Specifically mentioned. Which evaluation proof would be the best to reveal the indirect indicators of PF disorders? Ultrasonography ano? Almost correct, but exactly some word is mentioned there. What is it? It is actually in text B. Okay. Already we have read that line. Yeah. So what is mentioned here? So what is mentioned here? Is it MRI? Conventional radiographs can reveal several indirect indicators of PF disorders and should be examined even when patients are being assessed for other reasons. Okay, so answer is conventional radiographs. That is the correct answer. Indirect indicators, PF disorders. So very direct answer. Answer is conventional radiographs. Alright. Then question number 15. So here we are going to deal with 15 to 20 set of questions, which is fill in the blanks. So question number 15. Sufferers who were not complementing to the dash got precluded during the eligibility test phase. Okay, so sufferers, then complementing, precluded. So what is the correct answer here? Complementing, which means, what is complementing? Not complementing. So complementing, which means matching. Okay, so not matching to the dash got precluded. Precluded, which means excluded during the eligibility test phase. Okay, so what about question number 15? Any idea? Sufferers who were not matching, complementing. Sufferers, which means the patients. Yeah, so what is the correct answer? conventional radiographs, records ano? Answer is actually in text C. Patients were not matching to the dash got precluded. Exclusion kodutirikkuna evideya? It's in text C. Okay. So what is the correct answer? Answer is inclusion criteria, not records excluded. Inclusion criteria is the answer. Okay, inclusion criteria, that is the correct answer. And 16th one, the consumption dash more than 10 days should only be based on the doctor's direction. So what about that one? 17th one, there comes the correct answer, which is ultrasound. Okay, which is from, that is NSAIDs. Yeah, so from text D, one of this management treatment. Yeah, over-the-counter NSAIDs reduce pain and inflammation. Don't take NSAIDs for more than 10 days. Kanda. So answer is NSAIDs. That is the correct answer. And 17th one. Dash can show thickening and swelling for the plantar fascia and can confirm a diagnosis. So thickening, swelling and diagnosis. 17th one. And that is ultrasound. Okay, yes, Dilu, correct answer, NSAIDs. Yeah, 16th one. What about 17? Ultrasound. Yes, Amy. It is ultrasound, which is directly mentioned in text B, as you can see here. Yeah, ultrasound can show thickening and swelling of the plantar fascia, and which was confirmed by or in a diagnosis. Okay, then question number 18. The plantar fascia connects the dash in your foot together and forms the arch on the bottom of your foot. So what about that one? Bottom and connects. Yeah, very good. Bonds, direct answer. Yes, Amy, Rose. It is bonds. And where is it mentioned? Answer is directly mentioned in text A. Okay. Yes. The plantar fascia connects the bonds with your foot together and forms the arc on the bottom of your foot. So answer is bonds. And what about the second last question, 19th one? Roughly, dash people will pause plantar fasciitis at some point throughout their life. Pause, which means develop. Okay. Roughly, which means approximately. Okay. So what is it? Very direct answer, 1 in 10, which is mentioned again in text A. No, 1 in 10. Yes, Amy, very good. Correct answer. Answer is mentioned here in the second para. See, around, that is approximately or roughly 1 in 10 people develop post plantar fasciitis. Okay, so coming to the last question, 20. Take a break from the dash or participating in the activity that causes plantar fasciitis for at least a week. Okay, so what about question number 20? Yes, any idea? Yes, Dhanalakshmi, 1 in 10. Yes, Dilu, Sankita, Alina, Amy. Yes, very good, Amy. Answer is playing sports. Okay. And it is mentioned here in text D in the second bullet point. Take a break from playing sports. That is the missing word. Not word, words. Playing sports. Alright, yes. Alright, Sankita, Dhanalakshmi, Sanila, Josna. Hi, Josna. Playing sports. Yes, Dilu, playing sports. Alright, Alina. Yes, playing sports. So that's all about that. Okay. So take care. See you tomorrow.